All right, and we are live. What's going on, everyone? This is Andy Singer, Digital Media Manager at the Heartland Institute, and I'm here with Christina Herrin, I said your name wrong. I'm off to a good start. Christina Herrin, the Government Relations Manager of Health Policy. What's up, Christina?
I'm good. How are you doing?
I'm good. I'm off to a good start, getting your name right, doing everything I can here. Yeah, so usually we do these videos together, but it's usually you interviewing someone else. This time we decided, hey, why don't we interview you, Christina, so you can actually say what you want to say this time.
I'm excited the tables have turned and I'm on the other end of this. So.
Right? And usually I'm just in the background clicking a few buttons. I actually get to talk this time, so that's kind of exciting.
Yeah.
But yeah, so you're kind of the healthcare guru here at the Heartland Institute, doing a lot for us in 2021. And I'm actually wondering, what do you have on the docket coming up this year?
Sure. So I have a list, or the Heartland Institute has a list of several policy issues that we are going to focus on. And then we also have target states that we're working with legislators or other organizations in, just to be really strategic about what's viable and what could have potential passage. So some of those issues are going to be con law, certificate of need law reform, and then telehealth expansion, dental therapy expansion. We have some right to try expansion. There was something legislation in Texas 2 years ago. They're only in session every other year. So that might come up.
Wait, Texas is only in session every other year?
Yeah. So you have a very short time period to get things done there.
That's cool, though. I like that. Less government.
Yeah. Right. And then, on the federal level, we have some things with association health plans that might come up. And, I'm sure we're going to be fighting against some things like Biden care and expansion of Obamacare legislation. So I'm really excited. Yeah. So I'm excited. We got some good.
Obviously, we all think that Joe Biden's going to be president. Whether or not we agree that should be the case, is another conversation. But I'm sure that's drastically changed what you have coming up this next year. I don't want to throw a curveball question on you here, but is there anything that like the supposed or the upcoming Joe Biden presidency has really changed for your outlook coming forward?
Yeah, I mean, I definitely think we can all expect a Biden care proposal in some capacity, and I think that's going to be an expansion of the already flawed Obamacare system that we have in place. And I think it's going to include federal state Medicaid expansion. So that's going to be policy that makes state budgets look really good because you have, healthcare subsidized by the federal government, but in the long run, the taxpayers end up fronting the bill. So I think that's going to be really problematic. And, Obamacare has caused higher premiums. It's caused fewer insurers on the individual market. So I think continuing in that direction is only going to cause more state governments and just more individuals to be, dependent on the federal government. And that's no good for anyone. And that doesn't actually lower cost overall. It shuffles the bills around. So it's a little harder to tell. And maybe on paper for the individual, it might look like a better deal or a lower cost, but somewhere along the line, someone's subsidizing that, and we know that's going to be the taxpayer. So I don't know what the proposal is going to be because he has some things on his website, but it's not specific. And I think it'll be interesting when legislation does come out, if it does, and to kind of go line by line and see what's inside.
I know when it does come, you'll be on top of it, but yeah, I mean, the other thing is obviously coronavirus is going on, and I think we assume that Biden's going to do a little bit more, I don't know if draconian's the word, but hands-on approach to it. And I kind of liked the more decentralized approach, let individual places come up with what makes the most sense for them instead of try to shove one policy down on everyone. But yeah,
I completely agree.
Yeah, right. I mean, some of my friends would come to me, they'd be like, we need Trump to do more. We need like the central government to coordinate this for everyone. And I'm like, well, but then we're going to have to coordinate as if everywhere is New York, which was the worst, or California. And like, I don't want Montana to be run the same way that New York's run. It doesn't make any sense.
Yeah. I mean, honestly, we saw that with my dad. He was diagnosed with prostate cancer this summer.
Yeah.
And here in Iowa, there was a mandate from the Surgeon General. So at the federal level to stop all elective surgery. So that was any surgery that is not emergency. So if you aren't being rushed into the ER and your surgery is planned out on a calendar, it's considered elective and it's not emergency. And so his surgery, his doctor kind of told him, we just canceled, all elective surgeries are canceled basically the week he got diagnosed with prostate cancer and breast cancer, and was recommended surgery. The Surgeon General put out a tweet, and basically most hospitals and health centers stopped elective surgery. And so there's breast cancer patients, prostate cancer patients, people needing transplants that had to put that stuff on hold. So yeah, I think operating and at that time in Scott County, Iowa, where we live, we had 0 patients hospitalized for COVID-19. So I think that gave me some personal perspective on not operating the 50 states, the same way we operate LA and New York. We're all very different. So
yeah, I didn't even think about that when I brought up that point, but I think that's literally the perfect example of what we're saying here.
Yeah, I mean, it was real for us, and it did happen, and it's not just a statistic on paper. It was my family, and it was definitely scary operating under one unified, just federal system. Doesn't work. It doesn't work.
No, so. Decentralization often does work. So I mean, going back to the whole coronavirus thing, though, I mean, it looks like we're going into a second stage of lockdowns here, or going into / already in them. I mean, Illinois is back into which is where I am, pretty intense lockdowns right now. What do you think about all this, Christina?
I mean, I think we saw the first time how detrimental this was to people's mental health and obviously to their pocketbooks. I mean, making millions of people impoverished because of a policy perspective that one political leader thinks they know what's best for 330 million people. I think is asinine. I mean, my parents are older. Again, my dad had cancer. My mom has a heart condition, and my mom turned 69 this week. So I have older parents who are high risk, and in no way, shape, or form would I ever want to stop other people from going to work and doing what they need to do to put food on, the table for their family. So I think horrible government policy. And I think the mental health aspect that nobody is talking about, that the CDC just put out, that 1 in 4 adults back in June seriously considered suicide. Are
you serious?
That's from the CDC. And that's insane. I think that there's these unforeseen or unintended consequences that any normal person can easily see, right? When you seclude people and put them in, basically in lockdown in their house and don't allow them to work or don't allow them to see relatives and do different things, that the mental health aspect is just, incredibly scary. So
yeah, I mean, my grandpa's recently went into a end of life situation, and we're not allowed to see him. I'm going to visit, and I'm allowed to wave at him through a window. And I mean, I understand why, because he's very old. There's a lot of old people in there, but it is pretty brutal right now. Just what's going on with all that.
And I do just want to mention that there was a hearing last week. I wrote about it. I can link the article below after this, but there was a Senate hearing on COVID-19, and there's a really interesting statistic that one of the doctors brought up, and the fact that if you're under the age of 70, after infection rate, the rate of survival is 99.95% if you're under 70, right? And then if you're over 70, your rate of survival is over 95%. So
it's very high.
Yes. So I think we need to look at this through a more logical lens and be more reasonable. And then also look at the different drugs and medicines that could be taken to prevent this virus. And I don't think that many people are educated enough about that, or hydroxychloroquine, or some of these different already FDA approved safe drugs that could prevent the virus. We aren't looking at those preventative medicines. We're just looking for that silver bullet vaccine, which was approved this weekend. And I know that there's already several million doses being shipped out of the Pfizer vaccine. But, before that, I think we really need to look at how we addressed this pandemic, and hopefully in the future we can learn from the mistakes that were made and not make those same mistakes again.
Yeah, no, I wanted to ask you about that. So it was Operation Warp Speed was kind of how these vaccines came about. And obviously this was like a very expedited approval process when, there's a time of need. And I know that we did something similar to this, like you would know way more about this than I do, but with AIDS way back then, they had like an expedited, I mean, again, more than I do, but what do you think about this whole reforming the system when there's actually like a crisis going on? How bad we consider the coronavirus to be is part of that, equation. But do you have any thoughts on just the reformed approval process?
Yeah, for sure. So Operation Warp Speed, it did work. Obviously, it got us, the Pfizer vaccine that's out there, and then Moderna, and then I think there's potentially another drug or something that was discussed. But definitely, the Pfizer vaccine has already gotten FDA approval and is out and is being, used on the market. And so doing that in less than a year is almost like mind blowing if you know the fact that it typically takes 12 years and $2.9 billion to bring a drug from lab to market for all other disease groups. So obviously COVID is impacting 330 million Americans. So lots of people are impacted by this. So it's a high priority, but there's still other rare diseases or diseases, that are affecting and impacting 200,000 or even million, of several million people. And those diseases don't get the same treatment here, unfortunately, especially if you're a smaller startup. I mean, Pfizer is obviously very well known biopharmaceutical company, but some of the smaller startups, that cost and those regulatory barriers they have to meet, and oftentimes spending money on tests that have already been done. And part of Operation Warp Speed was working together, the public-private partnership, and then also having the biopharmaceuticals, really being able to have some of the bad drugs or the bad information. I'm not a chemist or a virologist or anything, but some of, the part of this was having the bad drugs fail faster concept. So it's not just having the Pfizer vaccine come out as quickly as it did, but there was a lot done of, which showed us what didn't work very quickly. And oftentimes there's kind of that gap where they're still trying to figure out if it doesn't work. And if we can figure that out sooner, it saves time and it saves lives for other disease groups. So I think applying some of these same principles to other disease groups would be, a really good step. And we have a policy proposal, Free to Choose Medicine, which does that. And it allows, information to be shared about life-saving medicine from patients in real world data. And I know that that's extremely important in new technological advancements for medicine. So I think just, encouraging FDA and NIH and CDC and the new administration and Congress to continue to consider expedited approval for future treatments and cures is really important. So.
Oh yeah, for sure. I mean, you could talk to just a normal person. They say like, no, we need to keep it slow. We need to keep it safe. Like we need to make sure that any approval or any drug that comes out is like so thoroughly tested, there can be no possible side effect, or not side effect, but negative. And then you talk to someone that actually has one of these diseases that can't get access to a medicine. And they're more along the lines of like, I'm willing to take a risk here. Like even if something bad could happen, like something's bad is already happening to me.
Yeah. And I mean, all drugs have side effects.
Yeah.
And to be clear, I want safe and effective drugs
Everyone does.
to be on the market. I want them to be the most safe and the most effective.
Yeah.
But I also think in that 10 to 12 year on average span it takes to approve it, if I'm on my deathbed, I want that risk benefit analysis to be between me and my doctor, not the federal government who doesn't even know my name. I think that that's kind of the disconnect of where FDA has their gold stamp of approval, but the world doesn't operate in black and white. There's gray zones all over the place where I think that determination, we need to remember, smallest minority on earth is the individual. It's not, the federal government's decision to make those choices for us. So I think that's super important too.
Oh no, I totally agree with you. So, I did briefly mention I might ask you this question before. I'm gonna go ahead and do it. What do you think about this vaccine? You gonna get it when it comes out?
I work remotely regardless of COVID-19. And again, like I said, I have family that's high risk.
Yeah.
And because of age, I think is the number one high risk category. And then there's obviously other sub high risk categories, which my dad's battling cancer. My mom has a heart condition. So, you know, I'm around people weekly that are high risk, and I, you know, practice social distancing, and I wear a mask, and I do all the things I do to need to do to keep my family safe. And if I've been around someone or, you know, a group of people that could expose my family, I will quarantine and not be around them. So I practice, you know, the best that I can. And I think in regards to a vaccine, I think if people have consulted with their doctor and it's the best decision for them, I'm fully supportive of that decision. Yeah. For those people, especially those that are high risk and those that are frontline workers that need to get the vaccine to stay safe and keep their family safe, I think that's really important. But I also, you know, don't exactly know the risk. I mean, I know this was done very quickly, and so I think I still have research to do, and I really strongly suggest everyone does research. Don't just listen to your government or one news station, and making sure you do your own research and looking at a variety of sites. And obviously the CDC is putting out a lot of information here. And like I said, there was just a hearing in Congress, and there's a lot of, you know, ways to access information. And I think sometimes we're this world with, you know, a cell phone in our hand, and it seems like we don't have as much information as we should, even though it's right there. So it's totally accessible. So I think get the information. And the last thing I'm going to say about the vaccine is the concept of herd immunity. Yeah, I was just reading a report, and I don't know, again, I'm not a biochemist or I don't have a science background, but I am able to read and analyze a report. But there was a report about herd immunity. So I don't know when, you know, how many million doses have to be, you know, distributed for herd immunity to take place. But I think I'll make the determination when it's accessible to the public if I do need to take it. I mean, right now, I don't know that it's accessible to me yet, but in the future, I will examine that and make that determination with my doctor. So I can't give you a yes or no yet because I don't have access yet.
That was like the best possible answer you could have. Like, I didn't know what kind of answer you were going to give, but that was great. I don't even know how to follow up with that. I was going to do this whole bit about how I just want to go to sporting events and I'll probably just get it for that. But your answer was smart.
Well, I'm going to throw the question back on you, Andy. What are your thoughts?
Okay. So my thoughts are literally just like my primary form of entertainment is just going to Chicago Bulls games and NBA games and Chicago Bears. It's just sports in general. And I like concerts and I like giant herd events, we'll call them. So I have a feeling that they're going to require the vaccine for the people that are going to these events earliest. Which I very much intend to be those people, the people that are first back at NBA games. It's like my favorite thing. So I will get the vaccine literally just for that reason. I mean, I'll do some research. I'll make sure it's like safe, but I mean, I gotta get out of my house. I'm going crazy. You mentioned the like mental health effects. I'm feeling them. Like I gotta go.
It is real. And if you look at suicide rates and the CDC has a lot of information in the past few months on mental health and when the lockdowns first started as well. And I think there's going to be some, you know, these unforeseen consequences. I think we will start to see those. And in preventative care, there's a lot of patients that aren't going to the doctor for their annual exams and they're not getting the preventative medicine they need. And that results in them, you know, typically going to the ER later. And a lot of times that bill, you know, falls on the taxpayer. So there's an economic and humanitarian cost here. And I just don't think that the government has calculated it out or has the ability to calculate what that is going to be in the future. And I think we're going to see the ramifications of these lockdowns.
Oh, for sure. I mean, just the way it works is like whether or not the government can calculate that kind of thing. You have politicians that are in office that care mostly just about getting reelected. And the way to get reelected isn't to say like, well, we have to consider the long-term cost of these. It's like, no, I care about coronavirus. I'm willing to do anything to stop it. Because that's what a lot of people care about, whether or not, because most people don't care about these ramifications that you're mentioning, which are very real things. But so these elected officials will just do whatever they can to please their constituents, which is often not the right thing to do. And it's often the most restrictive thing. But I agree with you. But outside of that, I mean, I think we touched on a lot of the stuff I wanted to get to here. Is there anything else that you want to say, what you're up to or what the Heartland Institute plans on doing? I
think we covered pretty much everything. I do just want to mention too, The issues that we're going to be working on are going to be con law, telehealth, dental therapy, right to try expansion. And a really big goal here is during COVID-19, a lot of these regulations for telehealth and certificate of need law, for example, were rolled back. So con law, we have 24 states that did repeal in some capacity.
Just to briefly stop you, con law, certificate of need laws, and can you just give a brief description of what that is for the listeners?
Yes. So 35 states currently operate and enforce certificate of need laws. So if a hospital is going to expand or add more beds or more ventilators, or someone is going to start a healthcare center, even if it's small, in a lot of states, the laws differ a little, but regardless, the certificate of need is required and you must get it from a board or from the state government, and you must apply for that. It's often a pretty lengthy process and quite a bit of paperwork, and it can be slightly expensive. So you'd have to apply to basically start your own business in the healthcare field. And a lot of times this is a crony practice. That wasn't the intention originally, but that's what's happened, right? You have one big hospital that's getting all of the business, and they don't want competition. So they're able to, kind of wheel and deal per se, and they can limit competition within the marketplace with this certificate of need requirement, where you have to literally present that there's need, which is kind of redundant because the government obviously can't calculate what's needed and what's not in the community.
Nor should they.
Yeah, nor should they have any involvement in that. I mean, if a business is going to fail, if there's not a need in the marketplace, the business is going to fail, and that's kind of the point. The goal was originally to protect the consumer, of course, and so that a hospital wouldn't be charging extremely, high rates to cover costs and things like that. But in the long run, states that operate with con laws today, their healthcare costs are 11% higher than those that don't operate with certificate of need laws. So we really have a problem on our hands. And especially during COVID, 24 states in some capacity repealed part or all of their certificate of need laws. So if it's acceptable during COVID, we need to consider why is it not acceptable during other times. So COVID has really taught us a lot, I think, and in telehealth, that telehealth space. I mean, there's been a lot of regulation rollbacks that allowed for expansion of telehealth, but just because COVID ends doesn't mean we should go back to more government controlling our decisions, right? If a hospital needs more ventilators, a hospital should make that determination, with their board and their investors, and that's how a business is run. So I don't know why healthcare is looked at as differently than any other business. Really, the market obviously determines need and not the government. And unfortunately, we have governments that want to control every aspect of our lives. And it results in not enough hospital beds for COVID patients or not enough ventilators. And, we need to consider in the future to potentially permanently, keep those regulations rolled back. So
it's almost like an admission, like these regulations and law didn't help.
Right.
And now that we actually have a problem, we're going to get rid of all of them. Right. And now once the problem's gone, it's like, oh, well, do we need these things? No, we don't. Clearly they didn't help in the first place.
Right. And I mean, with telehealth, a lot of this has to do, you're keeping patients away from, rural healthcare patients away from access to care. I mean, why would that make sense? Or with certificate of need law, it's costing the states 11% more in states that operate with con law. I don't know how anyone could look at that and think that's good for patients, especially vulnerable patients. It doesn't make sense. So I think our goal is to move towards patient-centered healthcare, and that's always our goal. And I think keeping a lot of these regulations rolled back permanently would be a great thing for legislators to do in 2021. And I hope that they stand up and voice the concerns of the free market advocates, because that's what we want.
Yeah, no, I for sure agree with you there. So outside of that, you got anything else you want to throw at us today?
I do have one last thing. I do just want to promote, Senator Rand Paul does have a great bill. I kind of mentioned it earlier in regard to expanding association health plans. This is something we've written about at Heartland, and looking to move off an employer-based health insurance model and allowing larger groups of people to work with insurers to get lower cost insurance. So whether you're part of a AAA or you work out at Gold's Gym or you're a Costco member, you could work with those people to get lower rates versus an arbitrary health insurance offered by your employer. So just looking at the gig economy and how our economy and our generation is changing the way work is done and how healthcare access should be, and looking to drive down costs and increase competition is our goal. So just keep an eye out for expansion of health association plans, and as kind of a counter argument to the Biden care I'm sure we're going to see in the next year.
Yeah. All right. Well, I mean, that just seems like an obvious one to me. Like, I don't know why. Oh, I mean, the government knows why. It's all for their benefit generally. But yeah. All right. So Christina Herrin, thank you for joining the show and for being on the receiving end of this interview. How can people stay up to date on your work? What should they follow?
I mean, our heartland.org/publications. If you go to topics actually and go to healthcare, you can find all of our work. So heartland.org/center-health-care.
Okay. Nice and easy. Love it. Awesome. And yeah. All right, listeners, if you're listening to this podcast, go ahead, subscribe to us on iTunes, Stitcher, Google Play, pretty much everywhere these days. If you are listening to this is on YouTube. You can check us out. We're both young. We're both good looking. You can see our pretty faces, or not, whatever you want. Outside of that, give us a 5-star review, subscribe. I'm going to say that again. It really helps us spread our message. And all right, we'll see you next week, tomorrow, whenever you listen again. Peace.